Welcome back, our dear viewers. Of course, the health sector in Egypt is of great concern to the Egyptian administration, not only for Egypt, but also for Egypt and Africa. And that was quite clear in the many initiatives which were launched by His Excellency President Abdel Fattah al-Sisi. A number of initiatives were launched, of course, to improve the health sector in Egypt and Africa. And we are honored to have with us, of course, today our dear guest, Professor Dr. Gamila Nasr, Professor of Cardiology and Head of Preventative Cardiology Department at the Egyptian Heart Association and Africa, representative in the International Society of Cardiovascular Disease Prevention, to shed more light on Egypt's efforts to improve the health sector and its leading role in Africa. Hello, Dr. Gamila, and always a pleasure to have you with us.
It's my pleasure to be with you.
Thank you. Always a pleasure, Dr. Gamila.
Very nice episodes.
Dr. Gamila, to start with, of course, His Excellency President Abdel Fattah al-Sisi was attending the TICAD 7 in Japan. And of course, Egypt was representing Africa, as Egypt is chairing the African Union. How do you see the efforts here exerted by Egypt regarding the health fields in the African continent?
I think this is a very important question, and I really, from your kind episode, I just have to greet our President Fattah al-Sisi, because being a president of the African Union this year, he is paying a lot of efforts to the health among African people. And this was very eminent in the TICAD. The TICAD, of course, if we are going for the abbreviation of the TICAD, this is the Tokyo International Conference for African Development. And if you are talking about African development, you are talking about a very important item, because one of the important items to develop a continent or develop people is just to promote health.
Indeed.
Indeed, yes. If you're talking about to promote health, this means they are able to create, they are able to work, they are able to live longer, they are able to do many great works and scientific activities, to do everything. They can even develop themselves. So I think it's, if you want to get a continent which is having welfare, and a continent that is doing a lot of eminent achievements, you should have healthy people, you have well-educated people, and this is what Egypt is doing now and trying to do under the actually the leadership of President Fattah al-Sisi in the African Union.
Yes, Dr. Gamila, since we are talking about the healthcare in Egypt and Africa, and how do you see here Egypt's role in developing the healthcare system in Africa? And we have seen, of course, a great success for the 100 Lives Initiative, which was launched by His Excellency President Sisi, and the great achievements reached in combating the virus C. So how can we benefit the African continent from our great experience in that domain and our great success?
Actually, Egypt has had leading campaigns for prevention, and we are talking of prevention. Let us just shed a light upon what prevention deals with. If we are talking about health, health means prevention. This is the definition of health. Prevention, then prevention, then prevention, and lastly come the cure and treatment. So, this has been, well known by the Egyptians and our dear president, and what he said, that he has to have a real role in the development of the African continent through prevention. So actually we had many campaigns to combat the hepatitis C, and it was just an amazing
Egypt was suffering a great time from many people, the number of patients with virus C.
I will tell you something.
Before the campaign.
It was, said that hepatitis C is the monster of Egyptian health.
Yes.
And it was an amazing to have bypass this monster. Do you imagine what means monster? So it was just an amazing campaign, which is really a very big experience, and this was
a
declared.
A dream that came true. Actually.
Yes, and the WHO, all the world have, you know, paid attention and looked at that campaign and this is initiative by an amazing view, and we did it. Also, if you are going to tackle 100 million people, Egyptians, and looking for health, their health, looking for them having diabetes, hypertension, obesity. And every important item. Very important thing, I have to say that you know that we have chronic diseases, and actually it kills more than around 80% of Egyptians. It's not the acute infectious diseases. And if we are going to look for the risk factors for these chronic diseases, it is more or less the same. More or less the same. So if you are going to you know, exercise scientifically, you are going to prevent more than 20 chronic diseases. What happened in Egypt through these campaigns, initiatives, we had looked for patients having diabetes, having hypertension, having obesity, and actually this campaign was able to detect many cases of diabetes and the pre-diabetes. Yes. And at the end, the health lifestyle is promoted, and now, as I know that the Ministry of Health is leading a very important initiative also to have some clinics to promote health and to lifestyle education. We have to change our lifestyle. This initiative means that you have to change your lifestyle, and this is a very important thing that, and we all know that Egypt is having a very strong data for the prevalence of chronic liver diseases, like being the 23rd all over the world for ischemic heart disease, 6th or 7th in the world for diabetes, obesity maybe number 4 or 5 all over the world, and this is very important. I have to ask to reply for your question about Africa.
Yes.
These achievements was translated to Africa as well, because Egypt has, you know, transferred its experience, and even it has transferred the new drugs for treatment of hepatitis C, which is still prevalent in the African continent. Doing prevention?
Yes. We'll be back to this point, Dr. Gamila, concerning repeating the model and copying the model that we have implemented here in Egypt in our country to the continent of Africa, our continent, but we'll take further this report about the Egyptian Health Initiative. Let's watch this report, and after that we'll continue our interview with Dr. Gamila.
The Health Ministry said that new comprehensive healthcare insurance system guarantees offering high-quality medical services to all segments of the society without any discrimination. The statement that was issued following a press conference held by Prime Minister Mustafa Madbouli to announce the launch of the new healthcare system in Port Said said the new system gives the people the freedom to choose their health service providers and reduces personal spendings on medical care. The statement added that financially challenged citizens will be exempted from subscription fees. The pilot stage of the new system will be applied in Port Said through 11 general and specialized hospitals and 32 healthcare units. Under the new system, citizens will head for the nearest health unit to the place of residence and conduct any type of medical tests they need. These units will refer them to the hospitals if necessary to make advanced tests. The new system will cover all governorates by 2032. The efficiency of Port Said hospitals was increased over the past 6 months to implement the new system. Among the medical services to be provided in the new system are open heart surgery, bone marrow transplantation, kidney and liver specialties, neurology and microsurgery. The new system second phase will start from 2021 to 2023 in Luqsor, Matruh, Red Sea, Qina and Aswan governorates. The third phase from 2024 to 2026 will be in Alexandria, Bahira, Dumyat, Sohag, Kafr al-Sheikh governorates. The fourth from 2026 to 2028 will be in the Beni Suef, Asyut, Minya, New Valley, Fayoum governorates. The fifth phase will start from 2029 to 2030 in the Daqahliya, Sharqiya, Gharbiya and Minofia governorates. The last will be from 2031 to 2032 in the Cairo, Giza, and Qalyubiyya governorates.
Welcome back, our dear viewers. Continuing our interview with Dr. Gamila Nasr concerning the health initiatives launched by His Excellency President Sisi. Of course, the Hepatitis C initiative, the 100 Healthy Life initiative, and of course, we have to talk about the insurance system which was implemented, the health insurance system. But before we are going to talk about Africa, of course, and what are the measures taken to support the African countries, especially in regard to the health coverage, tackling disease such as hepatitis C, such as, of course, elimination of the waiting list, which was a great success in Egypt as well.
Many steps have been, taken in this step, in every aspect, regarding the prevention, regarding the detection, regarding the treatment, even providing drugs, translating the experience everywhere. So many steps have been taken to get the African benefit a part of the success of Egypt's healthcare coverage.
Yes. Indeed. On the local front, Dr. Gamila, the Director General of the World Health Organization, the WHO, congratulated actually Egypt on its universal health insurance law, calling other countries to follow Egypt's example. How do you view this?
If you are going to talk about the insurance law, yes, it is just an amazing step.
Indeed.
And it is really a model, because I think it's in all over the world you cannot see such a huge step. What does that mean? That the health care system will cover everybody in the whole country. It will even cover, so far as we can see, this around covering 58. This is the existing system. It's covering about 58% of the population, but within 15 years, actually, it will cover 100%. This is an amazing step. It will cover the prevention. It will look for the pre-pregnancy and checkup. It will pre-marriage checkup. It will look for the athletes, checkup. This is an amazing step. Also, this will increase the effectiveness of the infrastructure of the hospitals all over Egypt, as well as improving the healthcare standards according to the international standards for healthcare.
Yes. As a doctor in that domain, Dr. Gamila, of course, and you are having many activities in the health sector, how do you evaluate the first phase of this insurance system, which was implemented in the governorate of Port Said, which witnessed a great success?
I do have the honor that I'm a professor of cardiovascular medicine in South Carolina University, as we can say. South Carolina University is, it is really actually dominating over this area. And in Port Said, this is a very nice coastal, governorate in Egypt, and indeed amazing governorate in Egypt, and it's a very nice, and it really responded in an amazing way to this new system, and already it's established. And I think, many, also I have to say about this system, I'll tell you something very important, that it has the capability to delineate between those who are giving the health care, the healthcare system, and those delivering the health care to the people, and those who are auditing. And also the money given to that. So it's very nice to get auditing for this healthcare system. And actually, the first steps will be taken in the Port Said, and it's just amazing. The second year will be in Ismailia, and maybe by within the year, as we can see 2032, this is when 15 years it will come to Cairo.
Yes. Dr. Gamila, what is the significance from your point of view of this health insurance system, and why His Excellency President Sisi was keen on improving the health of the Egyptian people? It was one of his top priorities, and we have seen many initiatives and many efforts exerted in this regard.
Well, actually, His Excellency President Fattah Sisi had, you know, the big view that to tackle the health problem in different views, through prevention, through treatment. If you are talking about preventive medicine, he had looked for the campaigns, detect the diseases, look for the risk factors, and for treatment is just to implement the insurance, universal insurance law. So it's two sides of the coin. You have to prevent, and on the other side you have to treat. This is very important, and this is what actually has been done.
Yes.
And I'll tell you something. If we are going to talk about the poor people who cannot afford having the you know, unique health standards, health care, this is considered very much, because it's just this law covers that the rich people can help very much in giving the health care, proper health care for the poor people. So it's actually it's a very important step, because somebody say that it just does it you know, give benefit to the rich people? No, it is not. It will give it to the whole country, to everybody, you know, under the sky of Egypt. So I think it's an amazing step.
Yes, indeed. Dr. Gamila, President Sisi also gave orders to finalize the patients' waiting list in all the public sector hospitals. To what extent the ministry was able to fulfill this goal?
It's a really it is a very important question.
Challenging. It was actually a challenging goal.
It was challenging. As we can see, we had a lot of health problems challenging the population. Egypt, one of them, that you have many cases are waiting for heart disease. One of them is the heart disease, the catheterization, the angiographies, and all of these. Many people, and also for the cardiac surgery as well. It has been. We have a lot of waiting lists. Many great efforts are being taken to cut down this waiting lists, and it provided you know, a lot of success to the people, and this was accompanied by satisfaction of the population. Of course, if you are waiting for a long time to get your health care, angio or something, that, and you will get it easily, this gives satisfaction to the people, of course.
From your point of view, what are still the challenges facing the health sector in Egypt?
I do suppose this is actually taking considered as well. It's that the nurses is one of the challenges.
We need more training
of the nurses, and it's all over the world. This is needed, and you have to integrate the pharmacists as well in the healthcare centers, because I think Egypt now is very considered about the role of clinical pharmacists. You know, that they should have a real role.
Yes. Do you believe that the number of doctors also, Dr. Gamila, needs in the future to increase?
The number of doctors, yes, of course, because we have you know, some you know, shortage in the number of doctors. But many steps have been taken to provide more doctors, but it is not in the expense of quality.
Yes.
And this is what really happened, and this is what the Ministry of Higher Education have did this year. It you know, it did not comply to the high number of those admitting to the Faculty of Medicine all over Egypt, but they just increased the little amount so that it will not be in you know, in the expenses of quality.
Yes. Dr. Gamila, moving on to the 100 Million Healthy Lives Initiative, what, in your opinion, is the most important significance of this campaign, which of course is touching almost every Egyptian citizen?
I'm very proud of this campaign because it's amazing. It did achieve a lot. First, it gives them how to look for the lifestyle. The Egyptians now are looking for their health.
Yes.
This is the awareness. This is very nice. This is the awareness.
Good health style.
Yes, lifestyle. And it's very important now for Egypt to take this role. Next, it detected already some diseases, and many people didn't know that they are diabetics.
Yes.
It did that. So I think it has provided a culture of healthy living that we all need.
Yes.
I congratulate all those who have this idea. It's an amazing, it is a worldwide amazing campaign. It did not, endless thanks to all of those who shared in this campaign.
Of course, great success concerning the health sector, and we are waiting for more. Of course, Dr. Gamila Nasr, Professor of Cardiology and Head of the Preventative Cardiology Department at the Egyptian Heart Association, and Africa representative in the International Society of Cardiovascular Disease Prevention. Thank you very much for being our guest for today. Always a pleasure.
Nice to meet you always, and I wish you a pleasant day.
Thank you very much, Dr. Gamila. With that, our dear viewers, we come to the end of this edition of Cairo Local Time. Hope you have enjoyed it. Until we meet again, I'm Rabia signing off.